So the public health approach to end-of-life care is really built on the foundational idea that 95% of the time that patients experience, they experience their journey outside episodes of professional care. Or if you want to reverse it, only 5% of the time that a patient spends, they spend in front of a doctor or a nurse. And that's what the international studies demonstrate. So for 95% of the time for a dying person or a grieving person, they spend that time alone, or with family, or with work colleagues, or with their dog, or with the television, or with the internet. So the big public health question in end-of-life care is, what are we doing in that 95%? And services, direct service provision, really occupies that 5%. And this is the huge challenge for us. What we've done in the public health movement over the last 20 years, and particularly working alongside hospices and palliative care services globally, is we've been encouraging them to develop compassionate communities. Compassionate communities are really neighbourhood projects. They are civic projects in the most elemental form. They are where a local area and neighbours and sometimes schools, sometimes workplaces, get together and volunteer some of their time to help look after people with a life-limiting illness or frail-aged, or people with long-term caregiving tasks, or grieving people. The compassionate communities movement, if you want to call it that, has been trying to populate that 95%. Recently we've had compassionate cities, and I think there's over a dozen of those around the world at the moment, and there's ones being added all the time. And these are where major businesses and trade unions and churches and temples and mosques and social media and cultural centres and sporting associations, local government, develop policies for the people in their care, their co-workers, their students, their teachers, and they're taking end-of-life care as part of their civic responsibility. The doula movement, if I might call it a movement, is at the centre of this public health initiative. It's the reason doulas exist. They were born and they journey for the whole issue of supporting people in that 95%. That's what doulas are all about. And they've been a more formalised movement compared to the public health initiatives, which have often been hospice-led. Not always, but often they've been hospice-led. What's fantastic about the doula movement is that it's civic-led. They are people from all walks of life who want to participate in end-of-life care. They're hands-on. They're an important mover and shaker, if you like, in modern end-of-life care. That an association will allow the doulas to become more mainstream, not just to have a profile, but to become more mainstream. Because internationally, doulas have suffered from being marginal, politically and in a policy sense. And there's no reason for that. Part of the problem has been that it's been a civic movement, a non-professional movement. And it's very difficult when end-of-life care since the Second World War has been populated largely by professionals. So becoming an association is important. In moving forward, I think the important part that doulas need to play is, one, think about that becoming a formal association, to think about that public presence, and to start moving towards that in a practical sense. You know, making those arrangements, getting on with it. But I think the second thing is that to understand in doula education, it's a particular education and training and support, that they understand basic public health concepts. It's not just journeying with the dying. Doulas are doing far more than that. They need to understand that there is a set of social and psychological consequences, what we call comorbidities of dying. The loneliness, the anxiety, the depression, the lost school days, the lost work days, the stigma, the social rejection, even suicide and sudden death. For doulas, the action that doulas are involved in is an important part of prevention, harm reduction, and early intervention. These are public health words, public health concepts, and doulas are at the heart of early intervention and harm reduction. And on the other side of the public health spectrum, doulas promote health and well-being. So it's not all about the bad things that go on in dying and grieving and caregiving, but it's also about promoting the positive side. So there's two things really going forward. One is a strengthened public health education and doula training and mentoring. And the other one is publicly profiling the good work and the civic work that doulas do, so as that we can be part of the broad church of end-of-life care, and in the future, the most important part of it.